what's next on Fresh Living, our continued series at Intermountain Medical Center. You've heard of heart surgery before, but what if they didn't have to cut open your chest? It's brand new. We'll tell you about it coming up next.
And welcome back to Fresh Living. Now, we've all heard of surgery, a procedure that can be life-saving for those with damaged heart and valve conditions.
Yeah, but for those people that fell into the inoperable category, the outlook has been grim until now. Intermountain Medical Center is once again changing the way medicine is performed. At 89 years old, Doris Brown still had a lot of life to live, but with each breath she took,
little by little, I became very weak.
It became apparent and confirmed that Doris was living moment to moment.
Dr. Jones said I was on the slippery slope. I had only a few more days.
After nearly 9 decades, Doris's heart valves were not working. She wasn't getting enough blood pumped throughout her body or enough oxygen. Typically, cases like this could possibly be a candidate for open heart surgery.
You know, the aortic valve's been replaced through an open sternotomy for 50 years, 60 years almost.
But this chance-at-life procedure was not an option.
Because of my age, they didn't want to open my chest.
Being inoperable in the past usually carried a death sentence.
Well, the options are really none.
But in this new advanced age of technology, there is another option being studied and used. Intermountain Medical Center is one of 22 hospitals in the nation that is part of a research study called the Edwards Sapien transcatheter heart valve, a procedure that uses a catheter to implant and replace aortic valves.
It's much less invasive to the patient.
It gives the once inoperable patients a chance at surgery and at life.
We feel fortunate to be able to participate in what looks like to be a real groundbreaking effort.
Still in its research stages and not readily available to the public, Doris is one of 44 patients so far to have received the revolutionizing surgery.
This is a very new technique, and I think we have evidence to say that yes, it is a survival promoting procedure.
The surgery uses a catheter that enters through the femoral artery in the groin or a small incision on the left side of the chest. In both cases, a balloon on the end of the catheter actually places the new valve.
We blow this balloon up under pressure, and what that does then is expand the valve and deploy the valve, if you will. Expand the patient's own native valve and just push it out of the way and take its place.
Another plus for the procedure is that the human body cannot reject the new implanted valve.
This is stainless steel. And then this is bovine pericardium. This is the outer lining of the heart from a cow.
Patients are usually back home within a few days after the surgery, like Doris was.
It was the 17th of March, and I was home in my own bed on the 19th. I felt wonderful.
And putting more life back into their days.
Well, I'm going out to lunch. And then I'm going to stop by at the needlepoint shop and pick up some breads. Then I'm going to go home and go to work.
That's
good
amazing.
For Doris, right?
It really is.
It is. As mentioned, though, the procedure is still very new and it's in its research stages. Dr. Jones does forecast that the procedure will be approved by the FDA likely within a year. For more information on this study or any of Intermountain Medical Services, please go to their website. It's intermountainhealthcare.org.
All right.
Yeah. We'll see everyone.